Testosterone is the primary male sex hormone. The pituitary gland, located at the base of the brain, functions as a master control center for various hormones, including those regulating testosterone production. In males, the testes are the primary organ responsible for producing testosterone. Testosterone plays multiple important roles in the male body. It promotes muscle growth and strength, and contributes to bone mineral density, impacting overall physical development and maintenance. This hormone also plays a vital role in sperm production and regulating libido in man, influencing desire and sexual behaviour. Testosterone levels peak in the late teens, around 17 to 19 years old. During the development of reproductive organs like testes and the prostate, as well as secondary sex characteristics like facial and body hair, a deeper voice, and increased muscle and bone mass during puberty. These levels generally stay high for the next couple of decades. From age 40 onwards, testosterone levels naturally begin a slow and gradual decline, dropping by 1 to 3% per year thereafter. Low testosterone levels can affect sex drive, mood, and changes in muscle and fat as a man ages. After age 45, semen volume gradually decreases. Seminal vesicles and the prostate gland contribute significantly to the volume of semen. With age, the function of these glands can decline, leading to a decrease in the amount of fluid they contribute to the ejaculate. The penis may become less sensitive to touch as one gets older. This decreased sensitivity may require more stimulation to achieve an erection. Erectile dysfunction, or ED, and visit every man at some point in his life. It is a type of penile disorder that affects a man's ability to get and maintain an erection long enough for sexual intercourse. Many physical and emotional factors can cause erectile dysfunction in males, with aging being one of them. By the time a man is in his 40s, he has about a 40% chance of having some form of ED, and this prevalence increases about 10% per decade thereafter. Testosterone plays a role in maintaining muscle strength and function. Decreased testosterone levels associated with aging can contribute to the weakening of the pelvic floor muscles and can lead to urinary incontinence, the inability to control the bladder, resulting in leaks or dribbling. Sperm morphology is also affected by aging, and the percentage of sperm with normal morphology begins to decrease after age 40, which affects fertility. Testicular tissue mass decreases with age, impacting sperm production. After the 50s, these changes become more pronounced. Testosterone decline continue, and issues like erectile dysfunction may become more frequent while sperm production continues to decrease. At age 70 and beyond, changes in testicular size and function often become more apparent. The mean testicular volume in men over 75 years have been reported to be 31% less than in men between 18 and 40 years of age, and sexual function continues to be affected. The timeline and extent of these changes can vary significantly from person to person. Genetics, lifestyle factors, and overall health greatly influence the rate of age-related decline. Some men maintain relatively good sexual health well into their later years. Healthy lifestyle choices like exercise, a balanced diet, and stress management can help improve testosterone levels naturally and promote overall health in older men. Testosterone replacement therapy, or TRT, is suitable for older men to improve symptoms of low testosterone like decreased libido, erectile dysfunction, and fatigue. In some cases, muscle mass and bone density, potentially benefiting individuals with age-related muscle loss. However, it's essential to consult a doctor due to potential risks and side effects.